Hello guys, welcome back to our next part. Is part number 2. First question is a maximum field of view which can be obtained with the specific radiography system is a generally limited by anode angle, anode size, focal spot, size. Actually question ask about the maximum field of view. Maximum field of view is covered in the focal spot size. So it is small focal spot is a small field of view. It is not small field of view. Actually it is a spatial resolution is good because lower field of view is a spatial resolution is a good, but focal length is a focal length of the length of focal spot, anode size and anode angle. The correct answer may be anode angle. So it is depend upon the anode angle. So it is a larger anode angle, it is cover the larger beam produced, but it's a lower anode angle, it is a lower field of view produced. So it is correct answer with the A, anode angle. When X-ray are emitted from the X-ray tube is the maximum energy of the radiation beam for a particular cave is determined by the total filtration. It is a X-ray emitted tube, maximum energy radiation X-ray tube. It is a total filtration. It is a inherent filtration plus addition filtration. Okay, so it's typically anode angle is correct answer with the 16 to 20 degree. It is typically anode angle, correct answer with the 16 to 20 B answer. Relatively low KV value used in some X-ray procedure for the purpose of, correct answer with the C, increase in the contrast sensitivity. Relatively low KV, so it is an increased contrast sensitivity, correct answer with the C. X-ray are modified electrons. X-ray इलेक्ट्रॉन से बने रहते हैं जो मतलब थर्मोनिक होके कैथोड से प्रोड्यूस होके जो बनाते हैं उसको इलेक्ट्रॉन से एक्सरे बनते हैं 99% हीट और 1% जो बनता है एक्सरे, वो भी 99.8% एक्सरे बनते हैं, 2.2% जो बनता है हीट बनते हैं, सॉरी 99% पॉइंट समथिंग में हीट बनती है और 1% में इलेक्ट्रॉन एक्सरे बनते हैं. सो मैक्सिमम की वैल्यू भी available for any diagnostic X-ray machine, that is actually maximum kV is using 150 kV. Correct answer with the B. The ossicles of ear passes sound vibration of the fluid in inner ear in the structure is this fluid located in the organ cortic, the stochastic tube, the cochlea and the Spherical and Uritica. So it is correct answer to the B, the cochlea. Which of the following is not a small bone involved in hearing? So it is correct answer to the meatus. Very small bone is a small bone in the body. It steps, and it is not a small bone involved in hearings. Malleus, steps, and meatus and incus. Actually, 3 bone: incus, steps, malleus. It is a correct. It is a ear bone, and meatus it is not. So it is correct answer with the C, meatus. It is not ear bones. Malleus. Okay. The sinus are involved in osteometals, sinus occlusion pattern. It is correct answer with the sinus are involved in occipital sinus. Osteometal sinus occlusion patterns. It is correct answer with the C, maxilla frontal posterior ethmoidal. This is which is sinus involved in osteometal. So it is a maxillary frontal posterior ethmoidal. Is correct answer C. Middle ear consists how many bones? 3. Already discussed: malleus, stapes and incus. Optic structure is part of sphenoid bone. It is correct answer A. The cerebrospinal fluid is secreted continuously at rate of the about per 0.5 ml per to 3 of ml. So it's about the cerebrospinal fluid in body. It is actually normal in 15 to 150 milli in whole body, but is cerebrospinal fluid continuously at the rate of continuously is fluid, मतलब continuously with the flow रहता है about 0.5 ml per minute per minute में होता 0.5 ml प्रोड्यूस करता है. Vessel not under the sympathetic control. Cerebral is a control of the sympathetic, splenic, cerebral, spontaneous. Sorry, vessel are the sympathetic control. So splenic control cardiac or cutaneous or cerebral. So it is correct answer to the D, C, cardial. Cardial is not a sympathetic. So it is correct answer. Next questions. Which of the following cells type is not a supported cell or glial cells of the central nervous system? Is a Schwann cells, is a PNS peripheral nerve system. Which is the following the type of cell not supporting cell or glial cell of the central nervous system is a Schwann cells is a PNS cell. Largest structure of brain, cerebrum is a very simple question. Then root of third ventricle is form of the tela cordica is correct answer with the B. Root of third is a root is mean the superior part of the ventricles. Third is a tela choroidae, correct answer will be IV finding in the renal artery stenosis all are excepts. So it is a actually first of all we discuss IV finding renal stenosis. Delay apparently nephrogram, it is a finding. Progressive dense nephrogram, progressively early wash out the nephrogram, stenosis, notching in ureters. So it is a correct answer with the B, because early washout is a nephrogram. It is not a early washout, because it's a stenosis meaning is like blockage stent. So it is correct answer with the, that's why it's not early washout. That's correct answer with the B. The name of given blood vessel in drain blood from granular after filtrations. It is correct answer will be the granular filtration is related to the renal. So it's afferent arterioles, efferent vein vessel. So it is a correct answer with the B, afferent arterioles, because it's blood drainage in the arteries, and that's correct toward the renal. That's afferent arterioles. Okay. Easy one. What is the entry point of the kidney for the renal artery, renal vein, lymphatic and nerve called is a renal hilum? What is the entry point? Is a renal hilum in between the two renals. Is connected in one point, that is a renal hilum. Renal artery stenosis may occur all of the following except its correct answer of polyarterial nodasa. So the answer ureters are the tubules that convey urine from the kidneys to the urinary bladder. So it is correct answer with the B. Ureter are tubes of the convey urine from the kidney to urinary bladder. Correct answer with the B. The kidney mammals malphalangia capsule is situated in the correct answer with the cortex. Kidneys of mammals and malphalangia capsule is situated in the cortex. Complete sentence of probability of the photoelectric effect occurring, correct answer with the B. Increase the atomic number, material become the larger. Complete the sentence. Probability of photoelectric effect is occur in increase if the atomic number material become a larger. Correct answer with the B. Diagnostic radiology photoelectric absorption occur in most of the absorption of the bone. How much initially energy of needed in initiate pair production? 102 milli-electron volt. Regarding the pair production of the annihilation of which is the following true, the is the correct answer to the B. Pair of the orbital electron ejected from the atom. Then next question, the tube current EMA in X-ray system is changed by changing filament current. Suppose this tube current is changing by the, if you want to change the tube current or EMA, so that's a change in the, you needed to change to filament current. So it is current is ampere unit, so ampere and current is equivalent, so that is correct answer with the filament current. Vein and limb have vein and limb have which one of the following characteristics? Vein and limb. So that's correct answer with the B. Vessel wall of the thick layer and smooth muscles. So vein and limb. So it correct answer with the B. What is the first process of the occurring after blood vessel is damaged? Coagulation, platelet plug formation, accumulation, and hemolysis. So it is correct answer with the first process of the after blood vessel is damaged. Suppose blood vessel is damaged, and then first process is a platelet lung plug formation, vasoconstriction, hemolysis because it's the first blood vessel is damaged and then blood in the outside in the body, so it's a hemolysis. So it's correct answer with the D. The right common carotid artery is a branch of bronchosepalic artery is from the arch of aorta. The correct answer will be B. The blood vessels which is carry deoxygenated blood from the heart is a pulmonary artery. The exception questions: arteries are always blood carries from the oxygenated blood, but here is a deoxygenated as. But keep in mind, it's a very important question. Is pulmonary arteries. Pulmonary arteries are the exception of the blood carries from the right ventricle to lungs, and then the pulmonary veins is carries the oxygenated blood in the RS system. Okay, thank you so much watchers. We meet in next soon part of discussion question. So bye bye guys, thank you so much.